Hi, everybody. Thank you so much for joining us today for our final event during Pain Awareness Month. It is My Pain Journey, a panel discussion with 4 individuals who are going to share their experiences with multidisciplinary care. My name is Nicole Hemmenway, and I serve as the CEO of the U.S. Pain Foundation. Today, I just wanted to go over our agenda quickly. After a short introduction, we will go right into our panel discussion, followed by a Q&A. So for those that are joining us through Zoom, please know that questions will be taken at the end. You may type your questions that you have for the panel in the Q&A button that you'll find at the bottom of your screen. For those that are on Facebook, hello, thank you for joining us. Please type your questions in as a comment and we will hopefully get to as many of them as possible. Again, for those that are tuning in through Zoom, our chat is open, but we're just asking that everybody is respectful and mindful of one another. As a reminder, US Pain does not endorse any one type of therapy or treatment. We all know that everyone is different and multimodal, multidisciplinary, individualized care is best. So this webinar is educational only and is not meant to take the place of the advice of a healthcare provider. We're hoping that you learn some new tricks and tools that might be helpful for you, but please have a discussion with your provider before making any changes to your treatment. Finally, I want to thank our 2020 Pain Awareness Month presenting sponsor, Sunbeam. Thank you so much for supporting all of our efforts this month, especially when it comes to talking about such an important discussion on multidisciplinary care. As I said, today is the last day of Pain Awareness Month. So for those of you who have not gone to look at uspainawarenessmonth.com, to look at our social media as well as our survey report, please do so. Also, if you have not checked out mypainplan.org or created your personalized pain plan, please go there as well. While supplies last, you may be able to receive a free heating pad from Sunbeam just by creating your plan. For those of you who have already done that, we have been getting a lot of inquiries and questions about when they'll be receiving the heating pads. We know that they are in the process of being mailed and shipped, so please let us know if you do not receive them by the end of October. So with that, we are here today to talk about multidisciplinary care, and this is such an important conversation. Recently, we conducted a survey on the barriers to multidisciplinary care, and it was fascinating to us to see that while experts agree that the best pain care is multidisciplinary, multimodal, and individualized, patients aren't able to receive that type of care. They aren't able to access it yet. An astounding 77% of you who are seen at a pain center or pain office don't have access to anything but a pain specialist. That means there's no multidisciplinary specialists like psychologists or physical therapists, etc. And so that is something that we really want to talk about today. I think it was really emphasized as well in the survey when we asked folks, what do your providers most emphasize? And that was medications and interventional procedures. Yet when we asked what patients wanted most emphasized by their providers, individuals wanted to have complementary and integrative health approaches as well as restorative therapies, followed by medication. So this really illustrates that we're not making multidisciplinary care as accessible as we could be. And so I am so excited to be here with Ryan Drozd, Dr. Sylvia Faircloth, Mariah Leach, and Linda Shaw to have this discussion. As a person who has lived with chronic pain since I was a child, I know firsthand how important it is to find a multidisciplinary approach to care. And let me tell you, along my own journey, it was a lot of trial and error. And finally, I was able to find those modalities that worked best for me. But I know that it is individualized, and I know that there are a lot of roadblocks and a lot of barriers. So with that, I would like to introduce Ryan Drozd, who is a National Academy of Sports Medicine certified personal trainer and fitness nutrition specialist, an RYT Yoga Alliance teacher, a licensed massage therapist, and Reiki master, who has been coping with chronic upper, lower, mid, back, and neck pain for close to a decade. Linda C. Shaw is a creative entrepreneur, poetic lyricist of Symphony of Sound LLC, and an author. And she has been living with osteoarthritis and chronic pain for over 2 decades. Dr. Sylvia Faircloth is an ordained minister who has lived with pain since 2003 as a result of rheumatoid arthritis, SLE lupus, type 2 diabetes, and spinal problems. Her mantra is, "I have pain, but pain doesn't have me." And finally, we have Mariah Leach, who is a writer, patient advocate, and mom of 3 living with rheumatoid arthritis. She is passionate about supporting women with chronic illnesses who are or want to become mothers, which is why she launched Mamas Facing Forward in 2015. So thank you all for being here today with us. If you wouldn't mind putting on your video screens, that would be fantastic. I'll stop sharing my screen. Great, thank you guys so much. We have a lot to discuss today. So I would like to start it off by asking each of you quickly to say, what are some 3 to 4 of the treatments or strategies that you are utilizing to currently manage your pain? And Linda, I will start with you.
Okay. Good morning, Nicole. Good morning, everyone. The number one method that I use, unfortunately, has been removed due to COVID, which is water. Water aerobics is my number one go-to for pain. Additionally, I walk as much as my body allows me to walk because I need to move in order to not feel pain. And third, of course, I take medication every single day, and I make sure that I take my medication as I should so that it can provide the best relief for my body as possible. So those are my top 3. Thank you.
Thank you, Linda. Mariah, would you share some of the strategies that you use?
Sure. I stay on top of my medication because I know that that's essential to keeping my RA under control. I try to learn and respect my own limitations, so I'm not pushing myself too hard to do everything all at once. Kind of related to that, I've been learning to ask for and accept help more often, which really can be a really big challenge. For me, I had a really difficult time learning to ask for what I needed when I really need help. So I started out by saying yes to any help that was offered. If my mom's over and she offers to unload the dishwasher, instead of saying, "No, it's fine, I'll do it later," I just say, "Yeah, thank you." And so accepting help has been a really useful strategy to not overextend myself and end up with more pain and fatigue. And then a favorite for me is Epsom salt baths. I like to soak in the hot water. I think the Epsom salts help. And also it gets me some time to myself away from my small children. And I think that taking care of my mental health is a really important component of taking care of my physical health.
Mm-hmm.
I think those are such great points, and self-care is so important. Ryan, what about you?
Yeah, kind of going along with what Linda said, movement, but within my limitations. So I've cut back a lot on the high impact stuff that I used to do. Like I used to do trail running or just regular running, and I don't do that as much. I'll just do like light hiking, or I'll go for walks. Because I feel like movement is so important no matter what you have, no matter what you suffer from. If you can incorporate a little movement in your day, it's important. And I also feel staying on top of medications as well. So I do take an antidepressant, so that seems to be helping. I went through quite a few of those, but if you can find something that really resonates with you and doesn't have that many side effects and reduces your pain, that's what you're looking for. So really, yeah, limitation, like knowing your limits, limitations, medication, and just movement of any kind, as long as it's not going to cause you more pain.
Exactly.
Thank you so much. Yes. And Dr. Faircloth, what about you? What are some of the strategies you use?
Okay. Hi, Nicole. How are you and
I'm doing
everyone?
good.
I am a patient of National Pain and Spine, and that's for my spine. So I see them on a regular basis. And part of that treatment is I get injections in the spine and so forth. Also, I take medications for pain, and I put my own pain in place as I do like a lot of walking and I do a lot of meditations and so forth, and it's helped me a lot with my pain. So pretty much that's what I'm doing now. So, but my pain has substantially, subsided during all those different, because I have like 3 different elements. I have a pain specialist for my back. I have pain specialists for lupus. So all those combined, they work in helping to eliminate my pain. Nicole.
Thank you. I think what's interesting is that everyone is using a combination, some of the same things, some that are different, but definitely something that struck out to me is the fact that really it is knowing your limitations and making sure that you stay on top of that self-care piece, which is really, really important. So thank you guys very much. Mariah, I did have a question for you. How did you learn about the treatments that you currently are using?
Well, I am really lucky that for most of my 12-year journey with RA, I've been being treated by the same rheumatologist, and he and I have developed a really good relationship where he knows me and he understands my life goals. And so I really trust the suggestions that he gives me for treatment, but I recognize that not everyone has that option. Not everyone has a good relationship with their provider. Some are still searching for the right provider and the right diagnosis, so it can be really challenging. And so outside of talking to my rheumatologist, I find that speaking to other people, other patients who are living with the same condition that I am, or even who just share similar symptoms to me, I find it useful to speak to them and see what works for them. That they can sometimes tell you about options that you wouldn't otherwise know existed. For example, recently in my support group, Mamas Facing Forward, one of our members learned about a new version of her injectable medication. They had reformulated it so it doesn't sting so much when you give yourself the injection. And her doctor didn't tell her about it. She learned about it from someone else in the group. So I think that talking to other patients with experience can kind of be a hive mind to help you troubleshoot and come up with ideas of what to try.
I definitely agree. Does anybody want to sort of add to that? I think it is so important to connect with a community support because really we rely on one another in so many ways.
Yeah, I agree with that too. I mean, just brainstorming, bouncing things off of other people, like what have you tried? Have you tried this? Have you gone to this specialist? I think it's so important to just ask around and see what's worked for other people. And then if it sounds reasonable to you, try it out. Worst thing that can happen is it doesn't help. If it doesn't help, then you go on to the next thing. So just being open to suggestions, not ruling anything out, and going, I think, at least from my experience, like least invasive to more invasive in that order. So you try what's least invasive first, and then you just go down the line into more invasive treatments.
Excellent.
Really good point.
I agree. I was going to share that I really didn't have a community. That's why I am so excited to be involved with the U.S. Pain Foundation. The knowledge and information that I've received has been phenomenal, and I look forward to being able to share the information. But as I had shared, I was active, up, working, going to work every day, normally like everyone else that I knew. And then all of a sudden, I was separated and cut off from everybody and everything. Everybody else was working, doing their lives, doing what they were doing, starting businesses, going to colleges, whatever. And I was at home, flat on my back, unable to move. And so it was like, yeah, I was totally separated. My social interactions were gone. There was nothing there. So it was really a very dark and lonely experience for me because I didn't know what questions to ask. And unfortunately, at my doctor's office, there was not much information or knowledge on pain and some of the things that I was going through. So yes, I must say that a community of people that you can get involved with, where you can talk to and share experiences and get information, is tantamount to helping you heal.
Great. Ryan. Oh, yes, go, Dr. Faircloth.
Oh, okay. No, I was going to say, I learned through trial and error, you know, after having so many emergency room visits. And I was just sitting in the ER one day, and a lady had referred her rheumatologist to me. And I think that was the best thing that happened to me, because I had been to many, many doctors, and it seemed like they didn't care about the whole self. You know, it's kind of like they wrote your prescription, and, you know, the rheumatologist would refer to me. I mean, she sits down, she takes time, and, you know, just basically cares about your whole being. So I think sometimes word of mouth can really be, you know, that door that we need to get the kind of, you know, treatment that we need. So that's my experience.
Yes, that is a great point too. Ryan, what is one thing that you think could be done to improve access to multidisciplinary care? We're talking about different therapies, different modalities, but the reality is that a lot of people don't have access, whether it's unattainable or because of financial constraints, or just access in general.
I think a big thing is better education for patients and better education for doctors, because there isn't a lot of information out there unless you visit groups like we discussed. Like, unless you talk to other patients that are dealing with something similar, it's really tough to get to that information that you need, you know, and to get pointed in the right direction. So I think there's also a lot of non-invasive options out there that kind of get looked over or passed by, like massage therapy, acupuncture, and other things that aren't covered by insurance. So I think those are great modalities, but I think if insurance companies would start covering those or adding those as, you know, maybe a copay option, I think that would be a step in the right direction. Because I remember you said the top two treatments were prescription meds, and what was the second that was like the highest?
The most emphasized by providers from a patient perspective was medications followed by interventional procedures. Mm-hmm.
Okay, yeah. So I just think that maybe steering a little bit away from prescription meds. I'm not saying that they're bad, or I'm not damning them at all. I think they're very effective, but I think just providing one other big option for patients as the first line of defense, rather than turning to that right away, because it doesn't, you know, always help in the way that we'd like it to help. And there are also a lot of side effects with that. So just going, you know, again, just educating patients, educating doctors, I think would be a step in the right direction. And then providing better coverage through insurance would also be a good option.
Great points. Mariah, did you have something to follow up with? Oh, sorry, I saw that you unmuted yourself. Just didn't know. Okay. No, I think that's so well said. We definitely need to have more coverage of these options. And then we also need to look at other self-management techniques and things that we can also do from home that will help us. Linda, have you ever tried a therapy that you didn't expect to be helpful or promising, and it was? And if so, what was it, and how did it impact you?
Okay. Well, let me just say it this way. I was hoping that it would be helpful to me, but it moved way beyond anything that I had ever imagined. I had went to the CU Anschutz Wellness Center in Aurora, Colorado, with a friend of mine, and they were offering massage therapy sessions. And so I was blessed to be able to have that done for me, and it literally changed my life. I still remember Matthew, his name, wonderful. He was a master massage therapist, and he was over the massage therapy clinic there within the wellness center. And he did a trigger point massage therapy on me. And I had heard the word trigger point, but I had never experienced it. And I'm just going to tell you all, when that man began to work my body, I literally jumped off the table because I mean, things happened that I had not experienced before. And I was like, what did you do? What are you doing? And he said, these are trigger points. And if these, can be released, it helps the blood flow, the muscle tone, everything to flow so that there's not pain in your body and, your system can flow. You mentioned about the osteoarthritis. I do have degenerative osteoarthritis of the spinal cord, as well as in my knees. So I've had the spinal cord surgery, 3 total knee replacements because one just went awfully bad because the MCL was also torn. And so they tried to fix them both and it just didn't work. So I have neuropathy and the pain just comes whenever it goes, however it wants to. I can wake up and just decide to walk and my entire left leg side from my groin down to my foot is like numb and in pain. And I get physical therapy, but physical therapy doesn't do it. So that massage therapy that I got, trigger point, it released my body from pain for 3 entire days. And that had not happened in 15 years. 3 days, 1 treatment. And unfortunately, we'll get into that a little bit more because of insurance and financial issues. I was not able to continue because he had laid out a program for me where he said, I can help you live pain-free and have, your life back. But I was not able to get those services, unfortunately. But yeah, massage therapy with a trained person that knows how to do it, for sure.
What a story. The fact that you had 3 days without any pain. 3 whole days.
Yes.
Yes. And again, I think it opens up to a great point about multidisciplinary care and the fact that it is unattainable for many people due to whether it is coverage or insurance barriers based on limits or caps. And so I think that's something that we could also discuss, and how many people have sort of faced those barriers.
Mm-hmm.
Yeah. Dr. Faircloth, did you face any similar sort of barriers? I know that one of the things, because what was the biggest barrier, I guess, that you faced trying to find treatments?
I think the biggest barrier that I faced was the fear of the unknown, because prior to me getting my diagnostic, I had a lot of issues that the treatments that I was having wasn't working. So I think the fear of whether I was going to find a treatment that would work, find a doctor that was going to work, I think the fear of the unknown. And I remember when my rheumatologist said that she was going to put me on biologics, and I said, bio who? First of all, I didn't know what that was. And then I had to realize that I had a fear of injections, needles, period. So that wasn't kind of working for me too well. So I think the fear of that, and then the fear of like Ryan was saying about opiates, long-term medication, then it's a kind of like a fear of, well, if I get on that, is that going to be like a long-term side effect? What side effects am I going to have? So I had all of these barriers for me, for my treatment, because, I was asking a lot of questions. How do I know, is this going to affect my liver or any other organ? Mm-hmm. And, so I think the fear of the unknown for me was the main barrier. And then trying to find a doctor, and then you have to wait for them to be available. Because a lot of times, when a specialist is in high demand, you don't just get to go in there and see them right away. You have to wait. My rheumatologist took me 8 months before I could actually have an appointment with her. So that was another fear, because you want someone that's a specialist on that what you have. So waiting that 8 months was a long time. So in the interim, I was going to doctors that they wasn't specialized in my illness. So that was another barrier, Nicole.
Thank you. I think the fear of the unknown is something that a lot of people living with pain deal with regularly. And then also when we talk about treatments, I think that there's barriers. Like you mentioned, you were unfamiliar with biologics and other medications. And so having that education, understanding why they work, how they might not work for some people, especially if injections aren't going to be helpful. I also know for others, once you find that treatment, then the barrier could be the financial side of how do you afford it. So I don't know if anybody wanted to sort of talk about that a little bit, if anyone had any experiences there, or if they have any suggestions for individuals that might be in that position right now, of what they might be able to do.
Yes.
I can say, do you want to go ahead, Ryan?
Yeah, I'll go first. So I was just going to say, in terms of massage, it's tricky because, yeah, insurance doesn't cover massage, and a lot of times they don't cover acupuncture. And I think it's a great modality. It's an excellent modality, actually, if you get the right person to treat specific symptoms, or if you have a trigger point issue, or if you have myofascial issues, then a lot of times that's the only thing that can help. Because if you have an overworked muscle, going to PT and overworking it even more is not going to help release that muscle or release that area of tension. So I think that in order to get that kind of treatment, if you don't have the funds, a lot of times what I'll do is I will do self-myofascial release or self-massage using like a rubber ball. Like I'll use a rubber ball. It's a simple like T-ball from Target for $5, and I'll hit some of those areas just using my body weight and gravity. You know, you can lean up against the wall, you can sit down. So just using your body in that way. And it's a cheaper option. It's not as great as having somebody, you know, manipulate your muscles physically for you. But if finances are a problem, then that is an option. I would definitely recommend looking into self-myofascial release or just self-massage.
Those are thank you so much. I think that's really helpful.
Mhm.
Maria, I know you had something that you also wanted to touch on.
Sure. I mean, I very much agree and wish that a wider range of options was covered by insurance. But I was just going to say that I think that even things that are covered by insurance can be hard to get or afford. We spoke of biologic medications. Those can be absolutely life-changing for certain conditions, but they cost thousands of dollars a month. And even the copay can be completely impossible to afford. And so I think one thing that I wish more doctors would inform their patients about is lots of times there's copay assistance programs that can help you cover the cost of a medication like that. So if you ever look at the cost of a medication and think, I cannot possibly afford that, take the name of that medication, put it in Google, and Google X medication copay assistance and see if something comes up, because sometimes there's help available. Now, those programs come with their own sets of red tape and hoops you have to jump through, but it's there. And the other thing that is helpful for me is that I feel very stressed out about the portion of my family's budget that goes to my healthcare. Like, we are blessed in many ways that often I can afford to get a massage or try other kinds of therapy or pay for expensive medications that other people might not have access to. But even so, even if you can afford them, I worry about, well, we spend all this money on my health. What could we be giving our children? What kind of experiences could they have if we didn't have to spend our money this way? And I feel very bad about that. And what my husband always says is those expenses are not optional. They're a part of our family. They're a part of keeping me healthy and happy in our family. And so we have to think of them as not optional. So we build them into our budget, and then we go from there, and I try not to feel guilty about it.
Mhm.
I think bringing up the guilt is such an important topic, because I think all of us have felt that way, that we're taking away from our families or our personal goals that we want, trying to take care of ourselves. And so I'm really glad that you bring that up, because I think that's something that we all deal with and struggle with. And so I also applaud your husband for saying it's non-negotiable. It's just part of your monthly expenses. Yes.
It doesn't always work to tell myself that. Like, I still worry about it, but
yes,
it's the right mindset. Like, we need to use the resources we have to get me feeling as healthy as possible, because that's what's best for our family overall.
Right. Right. Well, and then the other thing we touched on too is just sort of the copays, and copays sometimes appear affordable on the surface, but for people that have chronic illnesses, you're going to need multiple visits, and over time that becomes a financial restraint or constraint and burden as well. So I think that there's sort of so many different layers when we're talking about barriers. But I do appreciate you bringing up about the copay programs. I think those are some areas that individuals should be looking into. And Ryan, thank you for bringing up ways for self-massage or simpler ways that people can do these types of modalities from home. I think that is great. Ryan, I know that you also discussed just briefly about antidepressants, and you've been very open with me personally about mental health, depression, and pain. And so I had a couple of questions for you. From your perspective, how can society better support individuals dealing with pain and depression? And how can we work together to remove that stigma that is associated with mental health?
I think just understanding and accepting both. I mean, that was a big one for me because I think I just kind of tried to fight this diagnosis of chronic pain and then the link to depression that was there all along. You know, it was something that I'd seen a lot of different doctors for, and I was like, no, you know, it can't be chronic pain. You know, it can't be affecting me. Like, it's got to be something that's temporary. Because I think for a long time, most of us dealing with chronic pain, it's just like you just assume it's going to go away. You know, like when you're young, you get a scrape, you get a cut, and it just goes away. You know, it just heals on its own. But depression, like pain, doesn't go away. You know, it's a lot of times a lifelong, it's a life sentence. You know, for some people, it can ebb and flow, but for a lot of times, it's just something that requires treatment over the course of your life. And there's different severity. You know, there's different types of chronic pain, just like there's different types of depression. Like there's the blanket, you know, chronic pain medical definition, and then there's the blanket depression definition. But a lot of times, I think what you see in movies is a lot different than what people with depression actually suffer from. So it's often seen as something that just affects how you feel. Like you might just feel sad all the time, but it affects motivation, it affects you know, things that you used to enjoy at one point, you no longer enjoy, or you're no longer interested in, and it just doesn't look a certain way. So I think there's this stigma or this thought that depression looks a certain way and chronic pain looks a certain way. But I mean, I don't present as the typical depressed person. You know, you see me smile, you see me laugh, I'll tell jokes, but it's actually easier a lot of times for people with depression to hide it because they don't want to answer the questions associated with it. So I think just being more open about it and accepting that it affects people young and old and people that appear otherwise healthy.
Thank you. I couldn't agree more. And I know even just from our survey that it also came up that those in rural areas, the one thing that they wish they had more access to was support groups. I also know that individuals had said, I believe it was about 20% wish that they had more access to behavioral health specialists. And so this is something that is really important for people that are living with pain, and pain and mental health go together quite frequently, and we really need to be addressing both of them. So I appreciate you sharing that, and I hope that together as a society we can help remove those stigmas and make sure that individuals are getting the care and that they need to help them along their way.
Yep.
Yeah. Mariah, I know that you've been involved, and we already talked about this, with support groups like Mamas Facing Forward. And you did share a little bit about how to connect with others in similar situations is so important. And it also, I think, kind of ties into what Ryan's talking about too, because I really do think besides seeing a behavioral health specialist or a psychologist, there's something that is really helpful also with that community support, someone that gets it, that they've been there. And so I was wondering, do you have any advice, or how important is it that you've noticed through your efforts with Mamas Facing Forward for patients to connect and connect over similar yet different experiences?
I mean, I think it's very important because living with a chronic condition or chronic pain can be super isolating. You know, if the people around you haven't had these experiences, they don't necessarily understand what it's like. And for example, when I was a new mom, when I had my first baby, I had 3 friends who had their babies right at the same time. So there were, 4 of us, and we were going through new motherhood together. Mm-hmm. But I was dealing with unique issues on top of that impact because of my RA. I had to choose between breastfeeding and taking medication. I didn't know what to do when I couldn't close the tiny little baby snaps because my hands were hurting. I was looking for a baby carrier that I could put on easily because it was hard for me to pick up my son when I was flaring. And my friends didn't know how to support me. And so being connected to other moms who understand these unique challenges was really key for me. And it's not just in parenthood, it's, across the spectrum, whatever you're dealing with, it's helpful to talk to somebody who understands what it's like. That, they can provide you a sense of community, of not feeling isolated. As we talked about before, sometimes they have information or suggestions or things that can actually help you practically in your life. And I also think the connection is important because it gives you an opportunity to kind of pay it forward. Someone lifts you up, and then you can lift the next person up. And hopefully, if we all work together, we can make the situation actually better for patients down the line.
I love that pay it forward. I think it is so important. It gives you sort of a power again, and it makes you realize that you still do matter and you still have value. And I mean, that's part of how,
we discuss guilt. That's part of how I deal with my guilt is I pay it forward, and I get out there and I advocate for policy change that addresses the problems that we're seeing. And that makes me feel like I can turn a negative situation into something a little more positive.
So important and very, very well said. Thank you so much. Dr. Faircloth, sort of talking about, again, connecting. I know that spirituality is very, very important to you. And so I was wondering, how does that play a role in regards to health and managing your pain?
Spirituality plays a big role in managing my pain. And I'm reminded of a quote by David Wayne Dwyer. And he says, we're a spiritual being having a human experience. And I can relate to that on so many levels, because with pain, you really have to treat the mind, body, and soul, and the whole body, because a lot of times we have symptoms, but we're not treating the spiritual aspect of it. So when we begin to treat the whole aspect of the whole mind, body, and soul, you begin to feel a connection, because your pain is connected to your spirit. And so what I find helps me is I meditate like 10 minutes a day. I quiet myself down and I begin to feel the connection of my mind, body, and soul being connected, and that helps me to ease up on my pain. So spirituality is very important. It gives you clarity of your whole being. It gives you purpose. Maybe if you were depressed, spirituality, it removes depression. So it's so many things that spirituality it helps with your chronic illness.
Thank you for bringing that up too. And I think it's a good point that spirituality is more than just religion. It really is sort of looking at the whole body and finding that connection and that empowerment. So thank you. And I did want to say also, we've been getting a lot of amazing comments in our chat. So thank you to those that are tuning in. Ryan, there are so many wonderful things that people were just saying, applauding what you said, and great points about talking about mental health and depression that I just wanted to acknowledge quickly, as well as there has been a lot sort of just surrounding massage therapy as a whole. And US Pain Foundation is actually going to be hosting a self-massage discussion through our Building Your Toolbox series in October. So for those that were interested, please tune in. And I also know the other thing too, just to say, is that I know that massage is not for everybody, but it is something that potentially could be helpful for somebody's toolbox. And so again, it really is about trying new things and seeing what approach works best for you. Linda, I know that addressing healthcare disparities is a really important topic for you, and you recently joined our Disparities Solution Advisory Council. And so I wanted to know, from your perspective, are there further challenges that people of color face when accessing multidisciplinary care? Oh, and you're on mute.
Thanks, Nicole. I want to try to get this through real quickly. So I just want to say a couple of things from what I heard everyone say. I do want to thank Ryan for what he said about the rubber ball, because I know there were a lot of techniques that my doctors told me to use to help with my pain that required me to use my hands. But because of the spinal cord damage, my fine motor skills are damaged. I have no strength. I've tried to I've had surgery on my hands to give me strength so I can hold and manipulate, and Mariah button snaps, zippers. I said, people just really don't understand that when your body, Dr. Faircloth, when your body doesn't function, you know, scripture tells us in 139 that I praise you because I am wonderfully and fearfully made. Matthew at the CU Health Center, he had this quote by Friedrich Nietzsche, which says, there is more wisdom in your body than in your deepest philosophies. Our bodies are such wonderful instruments, and they need to flow. And my difficulty with the doctors, you know, I had a knee doctor for the knee. I had a ortho spine doctor, and when I would try to say what I needed, they would ask questions and say, oh, no, you need to talk to the spine doctor because that's not because of your knees. Then go to the knee doctor, you know, spine doctor. Oh, no, you need to talk to your knee doctor because that's not because of your spine. And I remember thinking to myself, I am a whole entire person. You can't put me into a box of a knee or a spinal cord. Look at all of me, because there's something wrong with my body. It's not functioning the way it's supposed to function. And I can go right in with that into your question about the disparity, because if we don't open our mouths, and I know for people of color, you know, history has shown that that has been extremely difficult, you know, going back to the Tuskegee experiments, where there is a distrust in my community. Now, some of the, you know, the younger people, you know, it's better now, but, you know, our parents and our grandparents and aunts and uncles, you know, I've lost so many to diabetes and other things that if they had just gone to the doctor, opened up their mouths, asked the questions. And now the climate that we are in now, where doctors, I love them, but they don't freely give out information that you need. You must be able to articulate to your doctor, whomever you are seeing, what you need. Do not be afraid. Do not assume that what you have is something that you are just going to have to struggle with for the rest of your life. Because I grew up in East Chicago, Indiana, and the adults around me had a nickname, arthritis. They just called it Arthur. You know, they gave it a man's name. Ah, you got Arthur, because it's just something that you have, and that's something that you're going to have forever. But, you know, there's so much of information now that we have where some of those old ideas and stigmas can be erased, and we can really get the help that we need. So I want to say, open your mouth. Let your doctors, physicians, whoever know, your family, whatever, don't be afraid. Let them know that you are in need and get the help that you need, because it is available. And then go to the U.S. Pain Foundation.
Oh, Linda, I love it. Thank you for that plug. But I think what you bring up is such an important point, and it really is about those cultural barriers. And that's what you're saying, that the way that everything you knew from a childhood, it was sort of ingrained that you don't speak out, you keep it internalized, which is also making it, that is just one barrier that people of color are facing, just finding their voice to speak out and to advocate if they are experiencing symptoms and pain, and then not to take no for an answer and to find the care that you need.
Much so, much so. Thank you.
Yes, thank you so much. We have been getting a lot of questions through our chat, so I wanted to go through some of those right now. One question that we have, and this one came from Facebook, is do you all, or have you all dealt with chronic fatigue along your journeys? And if so, do you have any tips for managing it? And if, has anyone dealt with chronic? Okay.
Fatigue is a huge part of my struggle. Always has been, you know, even before children came along, although I feel like in some ways it uniquely prepared me to be a mom because I was already dealing with fatigue beforehand. But no, fatigue is really challenging, and it's also a symptom that it's not visible, so people don't around you might not take it seriously, your doctor might not take it seriously, and it can be a really challenging one, and it's a learning curve, I think. For me, I go back to kind of the talk about learning my limitations and figuring out how to accept help, because that's something that I do that really helps me manage fatigue, because I get to know myself, and I get to know like how far I can push and what I can do and what the result will be later if I push myself this hard. And in situations where help is available, it doesn't need to be me doing 100% of the things. I can get help with some of the things, and that can save me some energy. So the spoon theory, if you haven't heard of, is a good one to think about if you haven't read. It's a metaphor for dealing kind of with the limited energy that you might be experiencing with a condition like this. The idea is you only have so many spoons at the beginning of the day. You wake up at the beginning of the day, you have 10 spoons. You have to figure out how to spend those 10 spoons on everything you need to do for the day. So, you know, you evaluate what's important and make that the priority, and then you give yourself grace for the little stuff that you have to let go. That stuff will be there, you know, the pile of laundry, it'll be there tomorrow. Like you can put it off if you need to take care of yourself. Because I think it's just really important to make sure that you're kind of keeping track of what works and what doesn't. And it is really frustrating, especially at the beginning, to kind of figure out what works. And sometimes you think you figured it out and it did, and you still end up fatigued, and it's frustrating. But I would say, you know, keep trying, pay attention, and try to figure out how to accept help wherever it's available.
Thank you. I think those are some great tips, and I definitely echo reading and checking out the spoon theory, because I definitely turn to it often, and it makes it easier for me, at least in my household, as Ryan and I both have 3 little kids, and so for my kids I could just say I don't have the spoons for it, and we're starting to understand sort of what that means as well. So I think that's great. Another question that we had was, someone's having trouble finding somebody to treat them, and they're driving about 2 hours just to see a general physician. So do you have any advice for finding a specialist?
Well, hopefully one positive thing from this pandemic might be the more online e-medicine, the ability to consult with someone who isn't necessarily right there available. And I know that's not ideal if you have physical symptoms that need to be addressed, but I think in some ways, hopefully, we'll be able to have more access to specialists that way. It's really a challenge if there's not someone in your area that you can, and then, you know, there's the barriers of there's only certain ones that your insurance allows. I think that's another area where talking to people who have experience in that, who know those types of specialists, might be able to give you a recommendation. I know, for example, The American College of Rheumatology has a database that you can search by geographic location. They'll tell you like where the rheumatologists are in relation to where you are. So something like that might be helpful depending on what kind of specialist you're looking for. But I can definitely see that that's a challenge, and there's something that needs to be done there.
Mm-hmm.
Yes, I think those are some great tips. And I also know that other professional
I'm sure they do for different types of specialists.
They do. So that could be something that individuals could look into. And also you could always reach out to US Pain Foundation, and we could always help you sort of find some of those links. Another question that we had is that we need to have insurance coverage for many modalities that obviously, as we all know, are not covered or have limited coverage. Do you know, how do you think we should be advocating for that? Or how can somebody advocate better for themselves or others? I know that US Pain Foundation, I'll let you talk right now, Dr. Faircloth. I do know that US Pain Foundation advocates day in and day out for access to care. So you can always come and sign up to be a volunteer ambassador and advocate. We really do need to use our voices and our experiences. But I also know that a lot of you advocate day in and day out on different topics and can definitely add a little bit of insight too from your experiences. So Dr. Faircloth?
And that was what I was getting ready to say.
I'm sorry.
No, that's okay. I was going to say, like US Pain Foundation or whatever other organization, that's maybe a national-wide organization, because, a lot of times, like I've had the opportunity to speak, at the assembly. I live in the state of Virginia, and use my voice to talk to the senators and the congressmen about these type of things, insurance. So your voice definitely has an impact on making changes. If you don't say nothing, you be quiet, nothing's going to get done. So you have to join some type of organization, or support group, because the more you're connected with the community, that's when changes happen.
Yes.
Mm-hmm.
Yes, absolutely. So I think we have time for about 3 more questions. Let me see here. We have a lot, so I'm going through really quickly. One question is, how do you cope when you feel overwhelmed?
I can address that, because going back again to the comments from every single person, when I was in that state of realizing that there was something wrong, I went through almost every emotion imaginable, from loneliness, depression, betrayal, bewilderment, fear, anger, all of that. And so when your body carries those types of symptoms, it just makes it more susceptible to becoming sicker. So what I learned to do basically is to calm myself, to relax, to connect with things that are familiar with me, things that bring you joy, things that just bring to your remembrance something that is good. Because when you allow yourself to think about other things and other people, you tend to not focus so much on yourself and what you are experiencing. And I want to say that you must sleep. You have got to rest. When your body speaks to you, listen to it. It will not steer you wrong. If you require rest, then you rest. If you feel like you're anxious and you need to do something, as I was saying, find something that brings you joy. And if there are other issues with anxiety and so forth, calming music, whatever you can to just get away from self to a place of calm and peace. I don't know any better way to say it, but it works. It works.
I think those are some great points. And sleep is so important. And I also know it's something that a lot of folks have trouble doing because of the pain. Yes. Have any of you had, here's another great question from Facebook. Has anyone had success with a holistic doctor? I'm looking to find one, but I'm afraid to add another doctor to my list, and I'm not sure if it's worth it. Have any of you had success with or have any of you seen a holistic doctor?
Yeah, I've seen a naturopath, Nicole, in the past,
Yeah.
and I had some success, but again, not much. I mean, I was just looking to try something different for symptoms of depression and symptoms of pain that I was experiencing. So I did find some like interesting things out about just my genetics and what I was kind of prone to, and also like a list of medications that were not good for me, like that she absolutely would not recommend for me to try. And one of the ones that did come up was one that I had awful results with. So it was interesting to see that like the list was correct and saying, don't try this medication, steer clear of this one. So I think it can be helpful for that as far as symptoms of depression. Not sure, what the specific symptoms they're dealing with are. I don't know, what their situation is, but it might be worthwhile to investigate, do some legwork beforehand, because it can be pricey, because most naturopaths or holistic doctors don't accept insurance, or they might give you a slight discount if you have a certain insurance plan. So just look into that before signing up or starting with somebody new.
I think that's some really good advice. And then the last question was, how do you fit in all of your medical appointments when you are working as well? I'm constantly having to request days off for appointments, and it's difficult, and work isn't always understanding, yet disability is too difficult, so I can't quit my job. So I wanted to see if anyone might have any thoughts on that question or advice.
That's tough. That's all I'm going to say, because it's something that you absolutely need. And that's why, I'm going to say it again, the U.S. Pain Foundation does exist, so that we can advocate, so that we can have a voice, so that the entire system is aware of pain and what it does, all the way even up to, the job that you are in, that they understand that this is just as necessary for you as the food that you eat. You have to take care of yourself so that you can heal, and then produce the type of work that they want you to produce, because you'll be well, you'll be healthy, you'll be happier, and you can come in and really do your job. If you can, just talk to your supervisor or whoever and just explain to them that your job is important to you, how much you enjoy it, but this is something that you just simply have to take care of, and just see if you all can just sort of work it out. Communication, we're talking about your voice. Communication is ideal in any type of issues that you're having in response to your body. So if you can communicate that, I would say I would try, because it would be worth your while to do it.
And I would add there also, depending on your diagnosis and what your workplace is, you may actually have legal rights to accommodations in your workplace. Your employer may be required to provide reasonable accommodations to make it easier for you to do your job and and take care of yourself at the same time. So that's also something that's worth looking into.
And I was getting ready to say that I'm on disability, and I know the job that I had, they worked with me real well. I didn't have any problems when I scheduled a doctor's appointment. I just had to let my supervisor know, okay, you have an appointment on today. Like I said, they worked well with me because they knew, my medical issues. So unfortunately, some people don't have jobs that work well with them, but fortunately I did. So, I guess it depends on who you work for.
Yes, I definitely would echo what Linda and then what Mariah said, as well as Dr. Faircloth, because I definitely think looking into the accommodations is something that first of all, it's a legal right. So I would definitely look into that. And it is so important because you have to take care of your health, but there are accommodations that should be provided depending on your medical condition that could help during this time. And then also it really is setting those boundaries, and it's so difficult. I know for myself, managing my pain and managing work as well as family life, it really is a juggle on days. And so I also want to just say is to be kind to yourself. Some days I feel like I rocked it and hit it out of the park, and other days I feel like I didn't accomplish anything, and that's okay. We really just have to be kind to ourselves as well on this journey. So I know that we still have so many questions. I'm sorry that we could not get to all of them, but to our panelists, thank you so very much. We have been hearing some wonderful comments in our chat. Ashley says, it's amazing how much relief I get when I find someone who gets it. It's such an important part of our mental health, which, as we know, also impacts our physical health a great deal. Nina mentioned, thank you, Mariah, for bringing up copay assistance plans. This is something I would like to look into so I can also share it with others. And Bluesette was talking about how mindfulness meditation, and I know that you talked about this too, Dr. Faircloth, really saved her life. And Linda, thank you so much. You brought up some amazing points that were also mentioned that a lot of people were saying after you said things, amen and yes. And so I just want to say thank you, because I feel that everyone here inspired so many people. And I think talking about, especially Linda, one was just finding your voice and feeling confident to use your voice to help yourself along the journey is so important. So to Ryan, Dr. Faircloth, Linda, and Mariah, thank you guys all for joining us today. For those that tuned into our panel discussion via Zoom, thank you so much. We really appreciated all of your questions, all of your comments. For those on Facebook, thank you all so much. As a quick reminder, I just want to say that today is the last day of Pain Awareness Month. So please go and check out mypainplan.org to learn about all different multidisciplinary care approaches that might be of help to you. Create your own plan. And just for creating your own plan, you, while supplies last, will be able to receive a free heating pad. So thank you guys for tuning in with us today. I look forward to seeing you all really soon. Take care, everyone. Bye.
Thank you.
Thanks, Nicole.
Thank you.